Hi, I'm Susanna Hopsolleran, Senior Editor for Hospitals and Health Networks magazine. Today I'm joined by Jennifer Kessel, Associate Vice President, Operations and Human Resources from Aultman Orrville Hospital in Ohio, and Erin Rumelhart, Director of Nursing and Quality from Providence St. Joseph Medical Center in Montana. We're here to talk about the critical access hospital journey to a high reliability organization. And Jennifer, what is a high reliability organization, and why did your organization choose to go this route?
Thanks for asking that question. It's really important because I think all of our hospitals started on the journey to high reliability back in 1999 when we all saw the publication To Err as Human from the Institute of Medicine. And so it's important for all of us to improve the safety of the care that we give every day. What we wanted to make sure that we had a good definition for what high reliability was in our organization. So we simply made it very, very easy to understand that it was doing things as intended consistently over time and then building a program that would really reinforce that idea in our culture.
Erin, what took you on this journey in your organization?
We had the same desire, I would say, that Jennifer has alluded to. Our primary focus within our organization is to cause no harm. We felt one of the main ways to do that is to increase our ability to provide safe, consistent care, and by doing so, we felt the best way was to implement a high reliable culture.
And Erin, when you undertook this, you had to create a culture of safety. What are some of the ways in which you created that?
We first sat down together as a team and identified where our opportunities were. We identified who were the key players in creating this culture. Also, what was our vision? What was our goal? What do we want patients to experience when they walk in our doors, and what do we want them to experience as they leave our organization as well? People come to us seeking care. They come to us for help. They come to us to receive compassionate, safe, excellent care. And so that was kind of our founding pillars as we were looking towards how do we do this, what does it look like, and where do we see ourselves moving?
What are some of the tools that you used at your organization?
So we started our journey back in 2009 when we actually created our own corporate safety statement. It wasn't until 2011 when we partnered with HPI that we really had the idea to incorporate the tools and tones for high reliability. So we, similar to Erin's organization, took those tools and tones and actually set new expectations for safe behaviors that we expected from all of our employees. We then educated and helped them build the skills that they needed. And then from there, we just reinforce and build accountability for what we define as our high reliability culture.
Erin, how do you support accountability and performance improvement in this culture?
We've incorporated, like Jennifer said, several tools that allow us to evaluate where staff are on the HRO journey. We also have empowered and encouraged our leadership team to model the behaviors and tools. We as well have 5 tools and tones that we have utilized to assess where staff are, and have built several different process improvements and action plans that we monitor and ensure that we are moving the cultural dial towards patient safety.
Jennifer, were there challenges that you encountered on this journey?
Well, of course, there are always challenges when you're trying to, shift your culture and change your paradigm, but nobody can argue with putting safety first. So I think that's the one thing that is consistent about what we're all trying to do in a high reliability culture is put safety first. And yes, there were some challenges in regards to how staff would receive this, in regards to would this be the flavor of the month, and if we just wait long enough, will it go away? And that didn't happen because we, as Erin said, engaged and empowered our entire team in a new culture and a new way of thinking, and giving them the tools in order to do that helped us really make sure that that was something that would stick, and that we made sure that those tools and tones were something that could be applied no matter what area you worked in, whether you were a bedside caregiver or someone in patient accounts who was responsible for ensuring that a patient's bill was correct.
Erin, if a CEO or a board of trustees wanted to get started on this journey, how would you recommend going about it?
I'd recommend them sitting back and taking a big look at where their organization is today. Really question where they have opportunity in regard to patient safety, what their goal is, where they see their organization going, and try to identify those weak points, also identify their strong points. Sit together as a team and get commitment amongst the board and your higher executive team to say, this is in fact what we're going to do, and this is how we plan to do it. I think it's a commitment by the entire organization to say we value patient safety so much that we're willing to make it a priority in everything that we do.
Thank you for joining me today.
Thank you.
Thank you.
Susanna Hopsalerin for H&HN Daily.